Hi, everybody. We're here today with our very own Dr. Perry. I'm going to have her introduce herself in just a moment here. But first, let's talk about what we're drinking today. What tea do you have with you today?
I am drinking a Earl Grey latte, breakfast blend.
Delicious. And I'm drinking a Dragon Well tea latte as well. Yay!
Cheers.
Cheers. Thank you guys for joining us again. I want to start off with a quote from Gandhi because today's episode is going to be heavy on self-esteem, specifically as a student going into a medical field. The quote starts with, "Your beliefs become your thoughts become your words become your actions become your habits become your values become your destiny." And another thing we are going to be referencing quite a bit is the 6 Pillars of Self-Esteem by Nathaniel Branden. So let's go ahead and start off with our introduction. So Dr. Perry, please share your background with us. Tell us about yourself.
Okay, well, hi, everybody. My name is Dr. Valerie Perry. My background in my undergraduate degree was human development and aging, specifically gerontology. I'm fascinated with the lifespan of the human population, and I gravitated primarily to the older adult population. I think it was actually a personal experience with my father that led me to the field of occupational therapy. I wasn't sure if I wanted to go PT or OT. It's like a big decision for a lot of students, PT or OT. And I actually had a personal experience working with my dad, working with both disciplines, who were absolutely fantastic. We love our PT friends. But I ultimately decided to go occupational therapy. With that mindset, I dedicated all of my time to learning everything that I could about occupational therapy prior to applying to the graduate school. I'm actually a West Coast University alum here at Center for Graduate Studies. Upon graduating from West Coast University, I began working in home health, in the home health setting. That was during the pandemic, a very difficult time for a lot of people going through unprecedented situations. I was working in the home health setting for about 2 years, working with every condition that you can possibly imagine, primarily COVID, actually. But there was cardio, ortho, and neurological conditions in there as well. Then after about, I'd say 2.5 years of working in the field, I came back to my alma mater, and now I am one of the assistant professors here at West Coast University. I teach in the adult course, and I also teach in the introduction to research.
We are so happy that you are here with us in our OT field and in the program. So we're going to dive right into self-esteem here. I'm sure we've heard it, we've seen it, we've experienced it, but what exactly is it, and what does it look like in the classroom? What does it look like in the field, and what does it look like when we're working with our patients? So I'm going to go ahead and start with describing what self-esteem means to me. And then Dr. Perry, if you can describe what self-esteem means to you, either as an individual or even as a therapist. Personally, I feel like self-esteem is when we think low of ourselves, we think low of our skills and our capabilities, we even begin to distrust our inner voice. So it kind of leads to that harboring of negativity within ourselves and just lack of trust in our own intuition. And I feel like as a student, going into a position where we're providing care for people and providing knowledge to students, if we're in an academic setting, there's that pressure, especially the pressure that we place within ourselves, I feel like. And me in particular, culturally, it was very expected for me to do well in school, and a lot of self-worth came from doing well in school. Mm-hmm. So I think going into the graduate program, I already had that heavy, heavy pressure with myself. And so I was constantly, I need to do well, I need to do well, I need to do well. But there were times where I started to question my own, like, what have I already achieved? You know, and sometimes we need to remember those things as well. Dr. Perry, can you give us a little bit about, like, what do you feel like self-esteem is to you?
Brought up a good point in the sense that a lot of students come in with such a high expectation of themselves to do well, to succeed, and to be the best at everything. And when students fall below that threshold, they automatically think that they're a failure. And they can really, with that inner voice that's so powerful within us, it can be incredibly debilitating. And I see it all the time where students just lose their motivation to further their skill set because they suddenly think that they're not good enough or that they don't deserve to be here. And that's not even the case. It's students come in with this high expectation, but if they knew everything, then they wouldn't be in this program in the first place. It would just be orientation day and we're hooding you, but that's not what the case is. It's, you need to grow, you need to learn. And I think a lot of students are afraid of failure.
Yeah.
And I see that and I feel that because I was once that student, just being afraid of failure. But I think we learn more from our failures than our successes.
Right.
I think that's something that it should be not something to be afraid of. It should be something to, in one way or another, dare I say, embrace it and learn from your mistakes so that you can continue to grow academically and professionally and ultimately as a skilled practitioner in this field.
Right. And I believe one of the professors had mentioned, like, if there is a time to start making those mistakes, do it now.
Do it
as
now.
a student, because that way you have the buffer as both being a student and you're growing and you're learning.
Absolutely.
And you get the feedback.
Yeah.
As a practitioner too.
We're in a safe environment here.
Exactly.
We're in the protective walls of the university. Make your mistakes here. You're not currently working under anyone's license, like such as when you go out into field work and you are working under someone else's license, and promote that growth and development and ultimately learn their strong suits, learn their strengths and identify their weaknesses. Okay, what are those weaknesses? Let's grow from that.
Yeah, I really like that. And from there, I think we can think about, okay, so how do students recover from noticing what they did wrong, and instead of fixating on it and dwelling on it, using that as a opportunity for growth.
Right.
Because a lot of times they're already having those negative thoughts and like self-doubt, that when they hear negative feedback, or maybe I did something wrong, they take it personally and take it to heart, and
they do.
It kind of prevents them from wanting to expand and grow from it.
Yeah, it becomes a barrier for them.
Exactly.
And how do we overcome those barriers? What do we need to do? What do we need to put in place to support the students, the future of occupational therapy profession?
Absolutely. And it makes me also think about, like, how can fieldwork or clinical instructors instill good self-esteem in their students as well?
Absolutely.
So we're going to kind of dive into those a little bit more here. Thank you for all of that insight, Dr. Perry. That was amazing. Like I said earlier, we are going to be mentioning Dr. Nathaniel Brandon's 6 Pillars of Self-Esteem. So I'm going to read some here. Practice of living consciously, self-acceptance, self-responsibility, self-assertiveness, the practice of living purposefully, and the practice of personal integrity. We'll go back to living consciously. When we think of living consciously, we think of living presently. And we hear that all the time in wellness programs, and even in online wellness coaches, for example. They'll say, be in the present, be in the moment. But what does that look like for a student who is juggling grad school, life, family, working their part-time? What are some things that we can do that kind of help us be in the moment during our learning? For me, I wanted to take this as an opportunity as a student initially starting, I wanted to take this as an opportunity to identify what my tools and my strategies are, what helps me learn. And it was a little rough at first. I didn't know that I actually like noise when I study. I didn't realize that I need to move my body in order for me to focus. These are some tools that I'm trying to bring up here. Sometimes we need a study buddy. Sometimes we can't have anybody studying with us. And so those are just some ways for us to be in the moment and conscious. And especially in the classroom, for example, sometimes we'll have someone sitting away from everybody.
Yes.
Because that's their tool. That's their strategy.
That's their strategy.
Yeah. So what are some examples of living consciously for you?
Oh, these are wonderful topic. I'm so glad we brought this to the forefront. So just to piggyback off of you for a second, I found out when I started graduate school that I am very easily distracted. So a lot of these classrooms have windows where people can see in. It's kind of like a fish tank situation. I had to be in a position, I positioned myself where I could be close enough to the front where I could see the professor, but I needed to eliminate those distractions so that if somebody walking by didn't catch my attention just by them walking by, I had to just like be present and in the moment. And then I also discovered that I like white noise. So I don't like a lot of noise, in that I like to listen to music, but the music can't have lyrics. So it must be instrumental. It has to be just soft instrumental. And that's kind of what helps bring me focus. And sometimes the music goes along with like the buildup of like the melody. It like gets me going with like, if I'm writing a specific paper or something, like really like, oh yeah, that was good. And then there's other things where some people need to have something in their hands because our hands are full of various neuroreceptors, and it's a calming mechanism. So if you're doing a public speaking situation, if you're presenting, or if you need to say something in class and raise your hand and volunteer information, it might be helpful for students to have something in the palm of their hand so that they can have that sort of grounding technique to kind of calm them down in that moment, whatever it takes.
So it sounds like all the tools and strategies that we teach our clients, we have to instill it in ourselves.
Practice what you preach.
Practice what we preach, right? I know it's easier said than done.
It is easier said than done.
It's doable. We can.
I mean, how many times have you found yourself in a situation where you've just worked with a client and you've told them to do X, Y, and Z, and then you're in the same situation, and are you implementing the same strategies that you've just told your clients to do all day long? Guilty. No.
Yeah, absolutely. I keep that in the back of my head. What would I tell my clients? Like if I feel like I'm stuck in a rut, or if I feel overwhelmed and frazzled, I'm like, what would I tell my clients? You know, like if I am struggling to get myself to go exercise, for example, I'm like, what would I tell my clients? So
those home exercise programs that just go in the trash every time you print them out.
Exactly.
Am I going to the gym every day? No, I am not. How can I expect my client to do it? So then that's how we can set realistic expectations for not only ourselves, but our clients as well.
And that's actually one of the other pillars. So that one's self-responsibility and self-integrity. We practice what we preach. We hold ourselves accountable to our values and this and that. It all ties in together. And that's the beauty about, you know, owning and embracing self-esteem in your practice, in the classroom, etc. And we did talk about self-acceptance a little bit. So that one is accepting what you can and can't change, essentially.
Very important.
And I think students constantly feel like, oh, we need to be in control of our environment, control of my studies.
Right.
But sometimes things happen and it throws us for a loop. And I think that's when people start to kind of question themselves.
Yes.
When it's hard for them to kind of overcome something.
Absolutely.
So do you have any like advice or maybe an experience that you might want to share about self-acceptance?
Yeah, I really just appreciate that we're highlighting accept what you can change and what you can't change. For example, in didactics, it's a very structured environment and they understand the criteria versus when you're in the field, life happens. We understand that. You may have a complete schedule of you're going to see, this happened to me. I woke up one morning, I had 6 patients that I was supposed to see that day. Within an hour, 4 of them canceled and I was home by 10 a.m.
Oh, wow.
And that's just life. That's just how it happens. So you need to be flexible in understanding that you can't change your schedule. Like for me, I was upset that I wasn't able to see all my patients that day because I had really good plans to see all of them. I was really excited to see each of my patients that day because I was going to implement a new strategy for them or teach them something new that I didn't get to teach them at evaluation. But sometimes I can't change what happened. They were sent back to the hospital. Someone needed to take them somewhere else. Like whatever it is, you just need to be more flexible and understanding that you can't change what just occurred.
Right. And I guess that also ties back into like, you know, you as a therapist, for example, if I went in and I felt, oh, they canceled because they didn't like me or things like that inner voice. So we can't control what they think of us. Nope. We can't control, you know, whether or not they have to go back to the hospital, etc. But what we can control is, okay, so what are the next steps?
What can we do?
What can we do next?
How can we improve from this?
Exactly. And so I think that's one of the biggest growing points from self-acceptance too. What are some things that I can hold myself responsible for and not? And so as students, we can hold ourselves responsible for, let's say, our growth mindset. So receiving feedback, for example, students can control whether or not they want to take that as a growing opportunity, etc. And so I think that also just comes with the field in general. Like we just have to be so used to being flexible and adaptable and
understanding.
That's right. Because not all the time can we control how our patients react to things, right?
No.
I'm going to use pediatrics as an example. So during my field work, I had an elaborate setup. I had purchased these expensive intervention tools and toys and all of this. And I was like, all right, we're going to go ahead and do all of this with this child. I see the child and they only wanted to play with a string. And I said, you know what? I can't control what they really, really want to play with at the moment. But what I can control as a therapist is, okay, I have X, Y, and Z. What can I do with X, Y, and Z? So we have the string. How can we make it OT? And I think to me, that was like the biggest learning experience in field work was accepting the situation.
Yes.
And learning how to adapt to it.
Yes. That's a huge skill for all students to learn. So well done for figuring that out on the fly.
Thanks.
As a student.
It took a little bit at first, and I started to question myself. But I was like, "No, I know what I know. This is what we're gonna do."
Yeah, no, that's a unique skill that some students like. Again, that comes into like that rigidity. It comes into like the mindset of like, this is what I'm going to do. This is what I'm supposed to do. This was my plan. I don't know how to adapt to anything else. Mm-hmm. And in the moment, especially as occupational therapists, we have to always be able to think outside of the box, and depending upon what setting you're in, you may need to think out of the box more times than not. And what do you have at your availability? What is accessible to you right now?
Exactly.
And how can you make this therapeutic?
Totally. Absolutely. Like how can we make it therapeutic? And that's when you have to trust yourselves the most.
Yes.
Right? In that moment.
Yes.
And that brings us to we're going to go ahead and skip responsibility because we did talk about growth mindset and all of that. Mm-hmm. Self-assertiveness. So this is actually something that I feel like a lot of students need to embrace early on. Yeah. And that might look like advocating for oneself.
Correct.
And even when you're going to fieldwork, advocating for your learning style.
Yes.
And expecting and knowing how to ask for advice and feedback.
It's a huge skill to learn.
Right. And so if you were to be a fieldwork supervisor or clinical instructor, mm-hmm. What are some ways that you would want to instill self-assertiveness in your students?
Yeah, great question. When I was a student, my fieldwork professor taught me this valuable lesson, and I'll never forget it. She said on the very first day of fieldwork, or ideally the very first day of fieldwork, you need to meet with your CI and tell them how you learn best. Tell them how you want to receive feedback. And I think that's incredibly important for students with understanding their self-assertiveness in understanding how to facilitate that conversation. And Reeza and I were actually just talking about this earlier, in that this should just be set protocol across the board. First week, first day of field work, whatever it is, your clinical instructor needs to set aside time to meet with their student to have this conversation. In most cases, I'd say 95% of the cases, you don't know your CI when you're going into these new settings. You are meeting them for the very first time, and you're expected to work with them for 3 months, 2 months, however long your fieldwork rotation is. Right. And so you need to establish a baseline and a baseline of communication, because the student needs to be able to trust the CI and vice versa needs to understand how to work with their student. And we need to find common ground right off the bat. So to elaborate on that, if I could give any advice to CIs and students who are entering into fieldwork, it is to have that conversation with their clinical instructor the very first day and understand when and how do they want to receive feedback, and how often do they want to receive feedback. Mm-hmm. Such as, let's say you're working in the hospital setting and you're working with a client and you're not doing something correctly. Not safety concern per se, but like you're not giving the correct instructions to how to use an adaptive device, for example. The student needs to identify with the CI early on, do you want me to correct you in front of, let's say, that patient? Do you want me to intervene in that moment? Or would you rather you do your thing and I tell you afterwards how you could have been more productive in that session? You need to establish that and understand Because a student, obviously, and we're going to talk about this as well, but students come from all different backgrounds. Will the student tense up and turn into a turtle and go hide in their shell if they're corrected in front of the patient and, say, the family? Mm-hmm. Or will they rise to the challenge and say, thank you so much, that is actually more appropriate. Here, let's start again. And then initiate the same instructions with the CI's commentary. I think that's really important to establish. And I think either the student or the CI or both, this should just be a set protocol across the board. This conversation needs to happen right off the bat.
Oh no, I totally agree. I totally 100% agree, because I feel like the moment you set those expectations in the beginning, it's kind of hard to backtrack from that, right? So now that you have a baseline, this is how I learn as a student. This is how the instructor will teach and provide their feedback. I think in the long run, this is going to benefit the student, and it's also just going to strengthen the field of OT in general, because you're going to have these students who are more motivated and more engaged and want to learn more, and they're excited to learn more. And they don't feel as, I guess, afraid and dejected, and they might already be going into field work already hard on themselves and questioning themselves. And so receiving feedback in a timely way, or maybe in a way that's more conducive to their learning, would be, I guess, empowering for them as a student. So,
and then those students also need to set maybe a time with their CI to have maybe weekly check-ins as well. As a fieldwork student, I wanted a weekly check-in. Am I doing okay? Is there room for improvement? What would you like to see me do next week? And it was always on a Friday, so that I could sit with it and kind of like let that simmer, let that feedback simmer, so that the next week I could implement what my CI was expecting of me.
Yeah, and I feel like that'd be on for the CI's part, it might be a great way for them to kind of monitor and track your progress as well. Because they're like, oh, they're taking what I said and they're implementing it.
And there goes back to self-assertiveness.
Exactly. And so it's a self-assertiveness both for the practitioner and for the student.
Correct.
So, love that. And I think even as in the classroom setting, self-assertiveness for professors, for example, I think obviously it's much needed, because setting that boundary and that expectation, I'm here to find your guys' strengths, and I'm also here to help you guys grow, but I'm also here because I have expectations of you.
Correct.
So I'm not a professor, but maybe Dr. Perry, if that's something that you feel resonates with you, maybe.
Absolutely, yeah. So with students, and it's I love being a professor. I come in. I usually teach third trimester students. First trimester, yes, you're acclimating to the university. I'm gonna ease you in. But by third trimester, I have an expectation of you, because I consider third trimester students to be juniors. So I'm going to hold you to a higher standard, because this is you're a junior. You have one more trimester, and then you're out in the field working with real people with real problems, real conditions. And so I do, on the very first day of class, I essentially simulate that CI conversation that we were just talking about, where my colleague and I explain our expectations for the class, and we lay it all out. We explain, this is what we're doing for this is how we run practicals, this is how we do assignments, this is how we do this. And we establish that early on. And then there's this really delicate balance as far as providing that feedback, because if a student makes an error, it's our responsibility to correct them so that they don't continue those habits. Because if there's a better way to do something, if there's a better way to implement an intervention or an approach or whatever it is, it's my responsibility to teach them.
Right.
So with that, you need to understand your audience, essentially. You need to understand who is in your classroom, and you need to be able to kind of read the room a little bit and understand which student am I getting to and which student do I need to maybe adapt my approach to. And we can dive into that a little bit further, but it's all part of the balancing act of how do I support your growth and development as a future practitioner of occupational therapy, but I also need to correct you and commend you at the same time. We call it the sandwich feedback, where we maybe start with a positive thing that the student did well, We may add in some things for room for improvement, or
Mhm.
maybe things that they weren't, that they didn't do right well at all.
Mhm.
And then we end with another positive comment. And so again, that's like the delicate balancing act of, I want to encourage you. I'm not trying to break you down. I'm trying to facilitate and highlight your strengths and show you and identify room for improvement.
That's beautiful. That's beautiful. And I think that's what helps students like want to do better, especially when they know what they did right. Because a lot of times they're like, am I doing this right? Am I doing this right?
Am I doing this right? They just need that validation.
They need the validation. So when they do hear that, okay, I did something right, and then they hear areas of improvement, they're not as fixated on that solely.
Correct.
But they will keep that in mind. So at least me personally, whenever I receive the sandwich method, I find it to be so useful and so helpful. And so I think Dr. Perry, you're amazing at giving feedback. So
thank you.
Yes, and it's a skill. It really is a skill.
It's a skill.
You know, I don't think it's easy at all, but at the same time, it's easy to notice strengths for sure.
Very easy.
In everybody, but there are times where you have to go in there and kind of give them, okay, so this is what we do need to work on. Yes. And so I feel like that's the hardest part, right?
It's the hardest part.
We're going to go ahead and touch on the practice of living purposefully. So this can look like self-discipline, and what goals, I guess we can say, do we set for ourselves?
Yeah.
And that could be as a professional, personal life. What goals do we set for our clients? Basically adhering to this kind of sense of self-discipline that we set for ourselves. I want to use entrepreneurship as an example, because a lot of times you see entrepreneurs and they're like, wow, these are the embodiments of like people with high self-esteem, like, and because they have this purpose to them.
They do.
Yeah.
They have like this inherent motivation to succeed, especially if they're an entrepreneur, because this is their livelihood. So there's so much motivation that's going into that, and vice versa with occupational therapy. Like, this is going to be your career.
Yeah.
And how do you make it? There's so many occupational therapists that I'm sure you can agree that love what we do. We love our profession. It's so a part of our daily life, being an occupational therapist, that we live, breathe, and bleed it all the time. It's innate. It's that motivation. It's that inherent motivation and that hunger to learn more and how to be a more effective practitioner.
Yeah, because at the end of the day, that's their purpose.
That's their purpose.
Trying to be better as a practitioner, that'll be the purpose.
And also that's their role. That goes into some of the roles that we establish for ourselves.
And we can see that in some, let's say, social media influencers who are OT, or people who have their own private practice, for example. There's so much entrepreneurship in OT, and I think that it's basically just a really strong characteristic that I find that they all have, is that sense of self-discipline for themselves. That also brings me to the next one. We touched on it a little bit, was personal integrity. So this is when our actions are in line with our values and our beliefs. We did talk about that one. The example was going to the gym and etc. But now what I really wanted to talk about was, how can we see self-esteem in our practice? How do we instill it in our clients? How do we instill it in ourselves as practitioners?
We work with so many people with diverse backgrounds and ethnicities, and the way that I do something is maybe something different than how you would do something. And I've seen this specifically, and I learned this actually in grad school. I was a part of a very diverse cohort, and I learned so much about that various diversities and ethnicities because of my cohort, because of my friends in my cohort. And one of the things that I learned is how to provide feedback to persons of color. And I'm just going to be very genuine and honest. All of you who are watching this, you can see me. I am a white woman, and I want to be very transparent, and I want to be very respectful in how I implement my feedback, how I educate someone on how to use a piece of equipment or whatever it is, because I never want to come off as arrogant or that I'm somehow being disrespectful in my delivery. So one of the things that my friend actually taught me, he's actually from Malaysia. He shared with me, and I'll never forget this, that people from his background, they don't take compliments well. versus I'm full of compliments. I just want to share them. I'll share a compliment with someone on the street. Like, I love your shoes. I love your shirt, whatever it is. Like, I'll just freely give a compliment, especially if someone is doing relating this back to occupational therapy. If someone is doing something well that they've been challenged to perform in the past, I'm going to really build them up in that moment. And this actually really resonated with me when I was working in the field. I was working with someone of color, and I was providing too much feedback. I was providing too much positive feedback. And I could actually sense that they were uncomfortable with me giving so much positive feedback. And it was because of what my friend shared with me in grad school that I went back to that memory. And in that moment, I adjusted myself. I adjusted my approach. I adjusted, and I actually took a step back because I don't want to overwhelm my client with compliments or make them uncomfortable in a situation. So it was one of those really delicate moments where I took a step back and I stopped myself and I really thought before I just continued.
Yeah, so we can see how sometimes self-esteem looks different to everybody.
Yes.
Yeah, for example, I completely understand where your friend's coming from, because we're not so, like, I'm Filipino and my background is, well, my dad, he's an eighth Chinese, but we have a, Asian American background, right? But growing up, both my parents, they never really received compliments either. It was, most of the time, it was them either getting told what not to do. And so whenever compliments are given to them, they get small. And I noticed this because growing up here in America, I would give my mom compliments and she would be like, no, what are you saying? No. So it's kind of like we reject praise occasionally. And I think that's something to kind of also take into consideration for our clients, or even as like our cohort mates, or in this case as a professor. Sometimes people shrink a little bit when they get compliments,
which is the opposite of what I want them to do.
Exactly.
Because I was raised in the opposite household where compliments were freely given, and that's how we pumped each other up. And you did well on a spelling test, and that went right on the refrigerator, proudly displayed for everyone in the family. It's just so interesting that now I'm learning as a practitioner how to, depending upon who I'm working with, depending upon what ethnicity I'm working with, I need to adjust my approach accordingly. And I feel it immediately. I'm very aware of it. So it's just one of those things that you just got to maybe be a little bit more in tune about, so that you continue to facilitate that therapeutic use of self and that establish that relationship.
See, and this is all really very, very helpful, because I grew up here in the States, and so I'm also a complimenter. I'm like, I love this, I love that. Yeah, I can see how it might not, fit everybody.
Right.
It doesn't necessarily help someone's self-esteem. It might even lower it. So but I think that's what makes you a good therapist, is that you're able to read the room, you're able to adjust and adapt to your client. And I think that's, me as like growing into the profession, I also feel like that's definitely needed, and that's something to take into consideration.
Right.
So how our patients take in self-esteem? Self-esteem, essentially, that builds as the foundation for their quality of life.
Yeah.
So I wanted to touch on maybe people who have neurodegenerative diseases and who can't really necessarily do the things that they used to do. This might affect their self-esteem. So for these specific clients, it makes me think about how we as therapists have to kind of address self-esteem in our practice or in our sessions with them.
Yeah.
And that might look like just them seeing progress, or maybe them adapting to a new equipment, maybe.
Right.
And
or
so
mastering that new equipment.
Mastering the new equipment, exactly. Even just like some small skills that they weren't able to do. And I think that kind of revolves around self-esteem.
And it promotes their self-efficacy as well. And that's some of the things that you and Reese and I were talking about before, was promoting our clients' self-efficacy so that they can be independent in those occupations that we instill in our profession. Is how do we make our client as independent as possible, whether we adapt the environment, modify the environment, whatever it is, like how do we promote their self-efficacy so that they don't need us? They don't need to be dependent on us anymore.
Right. Yeah, and I think self-efficacy, like in our clients, it can also translate to students and their ability to, succeed in school as well.
Absolutely.
They're able to do the research, they're able to write the paper, they're able to succeed through the practical. So yeah, I think overall, all of the skills and all of the little mini facets of self-esteem tie into their overall development, whether it's the client or the student.
Yeah.
Okay, so one of the questions that have come up was, what is the difference between having a low self-esteem and imposter syndrome, or imposter phenomenon, as they would say in some research? I thought that was a really great question because a lot of the time, I always thought it was like, oh, is self-esteem just imposter syndrome?
But you use it interchangeably.
See, that's what I thought.
And it's not.
But it's actually not.
Yeah.
And so I wanted to bring up this, a little note that I wrote to myself. And I wrote it here. It says, usually students who come from backgrounds where they're praised for good grades or have high expectations of themselves growing up, they have these like inherent traits going into their professional careers. Fear of failure or fear of rejection, for example. And that ties into their self-esteem and ultimately leads to imposter syndrome.
Right.
I do want to touch on an article here by Sawant et al. I apologize if I pronounced that wrong. They basically noted that high self-esteem in the medical field is necessary as it leads to better patient outcomes and stronger patient rapport. So it leads to why building graduate student self-esteem will benefit not just them as professionals, but the environments that they work in and ultimately their patients' outcomes.
And if I could just piggyback off of that for a second, that's one of the reasons why it's so important for students to learn those hands-on skills in the curriculum within the didactic work, is so that you can get that practice of what I tell my students all the time is sometimes they're still at that 6 feet barrier. They still think that they can't get close to their client. And it's like, no, you need to get in your client's bubble and you need to have that confidence to command the session. Essentially, you need to be able to come in and work with your client and have that self-esteem about yourself where this is what we're going to do, have that game plan so that the client feels like they can trust their practitioner.
Yeah, no, absolutely. And I think that ties back into the whole imposter syndrome by, we'll backtrack a little bit. Let's say, how do we define imposter syndrome?
Yeah.
So it's a phenomenon characterized by a feeling of irrational fear of being exposed or for perceiving their own achievements as fraudulent. They might not feel like they deserve the commendations that they get.
Yeah.
It ties back into their performance in the practicals.
Right.
Because they're like, am I fit to do this? At least that was my experience.
Yes,
going into a practical, I was like, am I fit to do this?
Do I deserve to be here?
Do I deserve to be here?
Am I good enough to be here?
Those are that negative inner voice
that's so powerful and can really jeopardize a student's success.
Yeah, their performance. If they were to take that same kind of mentality into the field, for example, it wouldn't benefit the patients in the long run, because if the therapist didn't trust themselves, then the patient wouldn't be able to trust them. They wouldn't be able to be as engaged. I really found that addressing imposter syndrome during didactics was super important. Like even fieldwork. Because that, especially in fieldwork, actually, because that was a time where I was like, now I'm in it. Now I have to be the confident person. I have to trust myself. And that's the hard part, is because we're challenging these thoughts that we have. And if we think about like CBT or cognitive behavioral therapy, we recognize when we start to have these things, and then what do we do about it?
How does that change our behavior?
How does it change our behavior?
How does that change how we're able to implement a strategy into this? It's like all intertwined, like what our thoughts, it fuels our how we behave. It goes back to the fact that whatever we think about ourselves, that's going to change the way that we behave and and our emotional response in that scenario. So how do we work with our client? How do we work with our clients? Sure. But also, how do we work with our students to use that approach, maybe components of CBT, to implement into the classroom setting as well? And I think one thing that I'd just like to highlight is one of my mentors, actually, she shared this with me, or helped to kind of negate that imposter syndrome, is telling students on the very first day of class, or maybe even throughout the trimesters, is pumping them up in the sense of saying, we said yes to you. You are in this program because you applied and you interviewed and you met our criteria and we said yes to you. You are in this program. Like, the competition is over.
Yeah.
Don't compare yourself to the person sitting next to you. Work together as a team, because that's the beauty of our profession, is that it's a team-based approach with our interdisciplinary team, with our PT friends, our pharmacy friends, our PA friends, our nursing friends, everybody. Like, we make up a collective group for the betterment of our client. So working together to promote that self-esteem and to quiet that imposter syndrome, that little tiny voice that's so powerful sometimes. Like, how do we shut that down?
Yeah. And I want to highlight something that a professor did, like, or at least she would kind of do check-ins at the start of class. And from there, it would kind of let people open up. And then from there, it would kind of, you would be able to see, oh, everybody else is feeling the same way. And as a professor, she was able to kind of quell all of those thoughts. Like, she was like, okay, so now that we know how y'all are feeling, what are we going to do about it?
What are we going to do about it?
Yes. And so I thought that was a really great strategy. I know you've done that a couple times too. So I'm like, again, I can only hype you up as a professor as well.
It's like, how do we change that voice? How do we shut that voice down?
Yes.
This is what you're identifying. Okay, what can we do about it?
And it goes back to, practicing what we preach.
Absolutely.
We want our clients to have really high self-concept and self-esteem, and we want them to trust themselves, but we as therapists need to do that too. So I like using this analogy a lot, where we talk about filling our pitchers before we can fill other people's cups or something like that. I'm so terrible.
No, I love that. I actually, Reeza and I were talking about that earlier. I love that. I don't think I'd ever heard that analogy before, but it makes perfect sense. You have to fill your own pitcher first, and then you can distribute amongst your friends and colleagues and whatnot. But you gotta fill yours first so that you can share with others.
Yes. And so what do we do to raise our self-esteem so that we can do that for others? And it brings me back to one of the stories that Dr. Nathaniel Brandon actually talked about in his book, where he mentioned a healer in a Indian village. A parent came to him asking for advice for his child. And he said, my son keeps eating too many sweets. What do we do? And he said, well, I also like eating a lot of sweets. Come back to me in 2 weeks. They were like, what? They were confused. And so he sent them away, and they came back to him 2 weeks later, and he said, now I know what to do. I was able to fix it myself, so now I can help your child. And for some reason, that stuck with me, because I'm like, wow, how can I be the same as that healer? Like, I am going to be a practitioner. How do I instill that in my clients as well? So I genuinely thought that was a really great story. And I'm like, same with the water analogy.
That sounds like a bit of self-reflection on his part as well. Like, let me think about this. Okay, now let me implement. Let me identify whatever, let's say, I hate to say the problem, but like, let me identify the issue here. How am I going to correct it now?
Right.
A little bit of self-reflection, a little bit of growth on his end, and then he can share it with others, which goes filling someone else's cup.
Yeah. And we have to fill ourselves first.
Yeah. Very interesting.
A little bit back to imposter syndrome. So a lot of the times we think, so it's high stress, high anxiety, depression, perfectionism. And then I mentioned before, I experienced that myself, but receiving support from professors and receiving support from friends and kind of doing a lot of the internal work myself was what kind of brought me out of there. So self-reflection.
Yes.
And another couple things from the articles that we have here. I am going to be sharing some of those down below. But we have self-esteem, so that's our self-worth, and self-efficacy, we talked about that, is our self-trust and the belief in our own ability. And then we also impact self-evaluation. So that affects our well-being, our attitude, our motivations, our academic performance, and our willingness to make changes within ourselves and within our environment. Just some final thoughts here. I want to read to you some notes that I wrote for myself. Part of our job as OTs is providing the tools and strategies for our clients to develop a sense of self-concept, self-confidence, and in turn help them build their own self-esteem to perform their meaningful occupations with nothing to hold them back. And usually what holds them back is that inner voice.
Yes.
So I feel like we as therapists need to do self-reflection and find out where we can make improvements and how to build our own self-esteem up in order to instill that in our clients. Like we've heard before, in order for us to fill the cups of others, I finally refined it. In order for us to fill the cups of others, we need to fill up our own pitcher. So each person, therapist, student, we're all different and we all have our own tools and strategies to choose from in order to fill our pitchers.
Right.
So some final thoughts from you, Dr. Perry?
Yeah, just one last thing. We always tell our students that we are in the occupational therapy profession, we are what we call lifelong learners.
Right.
In order to be an expert in your field or your clinical skill base, you need to self-reflect and have that self-awareness to understand and to essentially be aware of some of your limitations. Okay, so then if you identify what those limitations are or areas for improvement, we can say. So essentially we need to grow from our experiences and be adaptable and be meek to feedback and be receptive above all to feedback, because ultimately we're just trying to grow in our profession.
Right.
And we're trying to be the best for our clients that we work with. So two brains are better than one, right?
Absolutely.
So let's work together and let's collaborate and let's check our egos at the door and learn how to work together so that we can continue to grow professionally and develop in our skill sets.
Absolutely. And that ties back into that self-responsibility, one of the pillars, right?
Yes.
I just want to say thank you again so much, Dr. Perry, for taking the time to speak with us and to share all of the wonderful insights that you have as a professor, as a therapist. I hope that you all find this episode useful and maybe some insights can help you in your either academic or career journeys. Hopefully we'll see you again for our next tea time. Thank you guys.